Nearly, and I'd like to thank all my colleagues on both sides of the House and the Minister for attending. I suppose the Irish health system has been pockmarked by horrific political and systems failures by successive governments that have damaged and cost the lives of our citizens. Minister Riley had a chance to put in place an effective organ donation and transplantation system that would have saved the lives of hundreds, enhanced the quality of lives of thousands, and saved the taxpayer millions. Minister Riley ignored the opportunity to put in place by ramming through this flawed EU law on organ donation and transplantation, which I believe is disastrous. We look for this recall, for this debate, and to seek the annulment and the replacement of this flawed EU law. And I wanted the Minister to come in and listen to his colleagues here. I wanted him to hear the advice that we have gotten from healthcare professionals and from other organ donation groups on what should have been done. And since the Minister signed this EU law into Irish legislation, 65 people have died on our waiting list. There are 650 people waiting for heart, liver, lung, kidney and pancreatic transplants. In Ireland, one in 10 of those will die. If the 500 people who are waiting a kidney transplant were to receive one, we would save the taxpayer 325 million euros. And the 1,800 people who are currently receiving dialysis, it costs the taxpayer over 10 years 1.2 billion. If we had put in place a new system, it could have improved the lives of those who are on dialysis, shortened their waiting time looking for transplants, and would ensure that the taxpayer would save money and that there would be hundreds taken off dialysis early. All he had to do was follow what had been done in other countries. Now, there are those who have criticised this recall, both in government and in the commentariat, and they say that it will achieve nothing, but the evidence is to the contrary. The government have now said that the human tissue bill, which at the start of the year wasn't going to be published at all, will be published before the end of the year. We hope that is the case. The Organ Transplant and Donation Office, I hear from members of the media, is now going to get funding and staffing. And we have raised awareness to the catastrophic system we have in relation to organ donation in the country. And for the first time, a Chamber of Parliament is actually debating actual legislation, not the theory of legislation, but legislation on organ donation, which was the first legislation in the history of the state in relation to organ donation and transplantation. Up until 12 months ago, we did not have that legislation on the statute books until Minister Riley signed it into law. And Mark Murphy of the Irish Kidney Association has described that as the worst implementation of this EU directive in any EU member state. But the reason we have people waiting and dying on our organ transplant list is not because of the medical profession, because they have done their best with a system that is far from perfect. But the reason we don't have a proper and functioning organ donation and transplantation system is because of the failure of successive governments and politicians by not legislating properly for systems that will work. The perception is, as my colleagues have pointed out, in the general public that the Dáil and the Seanad make most of the laws in this state. The reality is, however, that it is ministers who sign EU law, they change it themselves with their officials, amend it, add to it, and then put it into Irish statute without referring it to the Dáil, the Seanad, or their own committees. In one 12-month period, ministers signed into Irish law 164 EU directives. Compare that to 49 acts of the Oireachtas, which were debated by 166 members in the Dáil and 60 members in here. This particular EU law started with a consultation process. It started in Ireland with a consultation process on the 24th of May in Dublin Castle, where the HSE brought in the experts, the healthcare professionals, the consultants, and those in the organ donation organisations. Amazingly, they had no draft of the version of this EU law that the Minister was going to bring into Ireland. In May, the Irish Donor Network, who are represented here today, wrote to the Minister and asked him to ensure that any draft would be put before the members of the Health Committee and debated by the Oireachtas. In June, the Irish Kidney Association, June 2012, the Irish Kidney Association wrote to the Minister asking that it would be brought before the Health Committee. In July, I wrote to the Minister, July 2012, asking him that he would bring it before the Health Committee with a draft prior to signing it into law. On the 27th of August 2012, without any member of the Oireachtas seeing this organ donation and transplantation legislation, which is this instrument, it was signed into Irish legislation. 10 days later, as is allowed for under this provision that we are using here today, 27 members of the Oireachtas of this Seanad wrote to the Minister asking for it to be recalled and that we would debate it 10 to 21 days from that letter being received by the Chair. We were prevented from doing so. The government did have admitted that we should have been recalled and that the debate should have been allowed. We have lost votes in this chamber to have it debated in ordinary time. But as my colleague, Senator Dennis Donovan, has pointed out, we are here to annul it so it will be replaced with better legislation. We're not here to have a debate on it. And this legal provision that we are using today is what is the mechanism available to annul it, not just to have a debate on it. But what should the Minister have done with this EU law? He should have done what they did in Croatia. He should have appointed one national transplant authority. That's what worked in Croatia. That's what increased their organ donation rate. And the head of the Spanish transplant authority, Rafael Matazar, said that's the most important thing Ireland could do. But the other thing that Dr. Matazar has said, he expressed concern that we did not put in place one national transplant authority like they had done in Spain and like they had done in Croatia. I'm not in favour of presumed consent, but that's a distraction on this issue. I'm in favour of what works. What works is one transplant authority and organ donor coordinators. We didn't get the recall last year. We have it this year. The government had conceded that we should have been brought back last year. We're calling the government into account as to why they didn't consult the Seanad, the Dáil and the Health Committee before this was brought into Irish legislation. This is a flawed piece of legislation. I want a new version brought in. It was a missed opportunity by the government to bring in place a 21st century organ donation and transplantation system for the people who are on the organ donor waiting list and are anxiously awaiting a phone call from a hospital in Ireland to say that they will receive a transplant. The most disturbing headline of the last number of weeks was the one in front of the Sunday Business Post following an interview by Dr. Rafael Matazar, which said, government's organ transplant policy costing lives. The 650 people who are awaiting life-saving organ donation deserve better from their government and from their public representatives. We must give them every chance, the citizens of this state, to fulfil their full potential, and as citizens of a nation, they are entitled to it. Thank you for your listening.
Tara.
Thank you, Cahirley.